Hello and good evening. Last week, an 85-year-old resident of Jaipur and two Italians, visiting Italians, tested positive for coronavirus, recovered due to a unique line of treatment followed by doctors at the Savai Mansingh Hospital and a team that was led by Dr. Sudhir Bhandari. This was in consultation with the Indian Council of Medical Research. Dr. Bhandari is a senior professor of medicine at the SMS Medical College and Hospital and also a physician and diabetologist. I'm joined by Dr. Bhandari now from Jaipur. Thank you very much for joining me this evening.
Good evening. Good evening.
So obviously, I mean, your success with these three patients has made a lot of news, and we do what we are trying to do is to really understand the facts behind this particular case, and also whether this is replicable. And could the same treatment be used in other cases, were the number of cases to increase? So my first question to you, Dr. Bhandari, is really that. Could you tell us firstly a little more about the patients, these three patients that came to you, and were they the same, displaying the same symptoms? And at what point did you test them for coronavirus, and what happened after that?
Now, at the onset, I must share with you that it was a great experience of treating three patients. And before I give you the details of what we did in three patients, our another 9 patients are on the same regime and all of them are improving. So that's very interesting. In fact, SMS is Asia's one of the biggest medical college institute, which I'm heading. And we were sensitized is what is going on around the world, especially starting from China and Italy since January and February. So we were mentally prepared because Jaipur is a big tourist place. So we were sensitized to take all precautionary care in case the first corona patient lands up here. If you recollect, 7 or 8 years before, similar panic happened when there was a swine flu epidemic. So Jaipur is a pioneer medical college center. We have been handling swine flu cases. So we were very strong to deal with these respiratory complications. Our feeling when first corona patient came was exactly the same the way swine flu patient came to us. So when 2 Italians, they were discovered to have corona, and third was a Indian patient from Dubai. Our second and third patient qualified to be in a high risk zone because they were senior citizen. The Italian patient has a pre-existing weak lungs, the cardiac problem, and 85-year-old Indian from Dubai was a patient of chronic kidney failure. So this was a challenge with us. Now, I must share with you that whenever such situations arise, the patient need to give a very specific treatment, the specific medical treatment, the supportive treatment. And we have the team of consultants. We strategize and we had to make a strategy that how can we use the combination of drugs to reduce the viral replication of virus load. Now, since we were already sensitized about the coronavirus, if you heard few years before there was a SARS and the MERS, that is Middle East Respiratory Virus, they also belongs to the corona family. There's been a lot of studies which exist in the literature that anti-malarial drug chloroquine was used to contain the virus replication. It is a term used for the virus growth. Once you reduce the virus growth or the virus replication, you reduce the intensity of disease and patient recovers faster. Similarly, we have a great experience of using antiviral drugs in RVD, that is retroviral disease, what you call it, AIDS. So we checked up the literature. We found out that if combination of these drugs have been found to be effective in a corona kind of COVID-18 virus, under close supervision, monitoring if at all there is any side effect or not, after due consent was taken, we got it ratified. We shared with ICMR. They also approved, yes, you can go ahead with this. And fortunately, when we started using this combination in our so-called high-risk patients, we felt that patient started improving. And in a week or 10 days, they became corona negative. So we got really good feeling. Now, it is a beginning of our experience. We are using the same regimen now, 9 patients we have, and I must share with you, all are improving. So basically, it is a very initial experience of ours, but this initial experience had such a phenomenal positive results.
Right. I'll come back to the treatment itself, but the 9 patients that you spoke of, what is their age profile and their background?
Out of 9 patients, 3 have the florid. You know, there's a a stage of corona complications. Some are very trivial symptoms, some have moderate symptoms, some have real frank of pneumonia. So out of nine, three to four patients have frank pneumonia or pulmonary complication. So they are the patient with different profile. But with the profile, our intention is that we want to reduce the morbidity and mortality. These are the terms used for suffering and the bad end results. So
Mhm.
we have been closely monitoring these drugs. There are absolute indications where they can be used. There's an absolute protocol which need to be followed when we use these drugs. Now, what happens when there is such a dreaded disease? And if you're using any protocol which has such a favorable result for a humanity, then we feel like sharing with our medical fraternity because we don't wait for a bigger and larger trials to definitely show the results. Only thing is that we need to ensure the safety,
Right.
we need to ensure the tolerance, which is well documented. These antiviral drugs which we are using, they are as safe as they can be used in pregnancy also. So our number of patients in which we have been using this now, these drugs have increased. Now you see, even ICMR has also approved hydroxychloroquine, which is anti-malarial drug for prevention of the healthcare contacts and workers. So basically, whatever we have been doing and using is well supported in document and literature,
Right.
and we are doing also our own research and documentation of it.
Okay, so I'm going to come back to the nine patients in a moment, but since you brought up hydrochloroquine, now the World Health Organization, and clearly it's a divided camp. I mean, there are people who seem to feel, I mean, the President of the United States has said so, but then his own health department officials have contradicted him. The World Health Organization seems to feel that this is not yet fully ready, or there is not sufficient research to back using this as a treatment for coronavirus. So how would you react to that?
Uh, I would honestly say that look here, anything is used, whether for prophylaxis or for treatment, it has to be absolutely under medical supervision. What happened, whatever the guidelines have come by the ICMR, these are the guidelines as per the documented antiviral effect of chloroquine for high risk health workers and the people who are in contact with cases of suspect. What happens, any of such guidelines which comes on WhatsApp or the paper or something, the population at large follows this blindly, which I absolutely don't approve.
Sure.
I would strongly say that all these guidelines have to be implemented by a very thoughtful under medical supervision. Let the doctor decide who are, because any these drugs are also not absolutely safe of side effects. So I would recommend to the public at large that please don't implement these guidelines at your own end. Let a doctor take the call for you. But I would only say that if you really want to be active and you want to contribute in corona or COVID containment program, please isolate yourself. We have to protect our country by preventing ourselves getting into the stage three. So I would request public at large, if you want to follow something, follow the advice of Honorable Prime
Right.
Minister and government to distance yourself.
Yes, yes, and that's absolutely understood and a given that, and now we are in a 21-day lockdown or a 20-day lockdown now, and that will hopefully yield those benefits. But are you saying, therefore, that using these medicines, which are essentially used for HIV or malaria or swine flu, uh, can be used to treat coronavirus, or is it something that is still in
Now,
experiment
again,
stage?
I would say, as I told you, why such an early observation shared with a medical fraternity? Because it has a useful effect.
Hmm.
We have been able to make people corona negative faster. We have been able to make people recover.
Hmm.
Hence, whenever there are such advantageous effect are there, it is our moral duty on humanitarian ground to share with
Okay.
fraternity. Probably, I would say that we should not talk about it is replication. It is let the medical fraternity also go through the literature. Let the medical fraternity also make a guarded use of them under total supervision after consenting. Let a bigger trial, but there's a lots and lot of literature, about the drugs which we have used, because till you have the foolproof treatment available, you go by the available data of the few drugs which have been found to be effective.
Right.
There's been a wonderful paper from the France which shows that antimalarial combined with one of the antibiotics, azithromycin, the biggest risk is that if I take the names of the drugs, the whole population is going to be doctor by themselves. So the challenge is that I don't want to take the names of the drug, but there's enough data available, enough research available, and if any experience of a drug is good in a very dreadful situation, probably it is our moral duty to share with our colleagues to take a thoughtful consideration, to use them in a very safe and a guided manner under supervision. If you can help reduce the suffering of the people, if you can help people to survive a difficult situation, probably, there
Right.
has to be always a beginning first, but I again repeat, it has to be totally under medical supervision. These observations are not meant for public at large. Public has to talk to their respective doctors, what to do and what not to do. These are just observations which are more valid for medical fraternity.
Right. Okay. So you're anyway. I'm from what I'm taking away from what you're saying is that this is an experiment which has worked, but it's even to check it or test it further, it has to be done under by doctors, of course,
Yeah.
and under very very tightly controlled
I
conditions.
give an example. The patients in which we are using, we have been monitoring on day-to-day basis like a research patient. You got my point. So
Yeah.
it is our moral duty to be so careful. And I'm sure we are using the very safe drugs. We are using very carefully. Patients are tolerating it very well. There's been not any side effects so far. But it is our moral duty to share with medical fraternity that yes, we have been able to reduce the sufferings, the morbidity and mortality among patients. So you please also think in this direction.
Right. Now, amongst these nine patients that you're currently treating, are any
Yeah.
of them older in profile? Are they in
No,
intensive care
the
unit?
four are nearing 60. Two
Hmm.
have turned COVID negative. I'm just sharing with you,
Yeah.
and rest all who are on our regime, but they are improving well. So the bottom line is that we really want to help people. They start recovering well. We am sure we'll collecting the data. We are collecting their profile that they are responding well. So I'm sure we should be able to publish more data, more
Sure.
experience, share with our colleagues. Because our end bottom line is that we want to help medical fraternity, our colleagues share our experience. At the same time, we want to benefit the patients.
So these
And
patients are not in intensive care requiring respirators and
no,
so on.
I think, yes, let me tell you one thing. Out of our first three patients, two
Hmm.
patients were on ventilator. They were off ventilator very fast.
Hmm.
Here, out of nine, six patients were on oxygen.
Hmm.
Now, only two are on oxygen therapy. They are recovering fast. So, I would say academic data and academic details, probably I would only say for a people at large that it is showing good results. Patients are recovering well. It will be premature to share the minute medical details because
Sure.
everyone has his way of interpreting and misinterpreting. So
Mhm.
bottom line is that yes, we have been trying to help patients. At the same time, we are trying to reduce a viral replication and viral complications. So we just making an attempt as a whole team to patient recover faster.
Right. So, and I think you made an important point that, being in Jaipur, which is a very high density tourist center,
Yes, yes,
and therefore you see far more traffic than maybe, at
yes,
least in the concentrated way, than a city
yeah,
like Mumbai, where I live right
yeah,
now.
yeah.
So, what are the lessons going forward? How would you, I mean, even as this evolves
Now,
and treatments
here,
are found?
off other than treatment, I must explain to my fellow countrymen that we should learn. Countries like South Korea, Thailand, and Singapore are closer to China. Normally, what happens, the natural epidemiological study of this coronavirus is that initially, if you see the statistics of Italy, there were few patients first week, around 200 in the second week, around 500 in the third week. In fourth week, they zoomed to 7,000 and fifth week 21,000 with equal number of deaths. I would request my fellow countrymen that ready doctors or alert doctors are no answer to this. The proactive medical system is no approach to this. We need to respect the emotional, the humanitarian, the loving, the requesting appeal of our Prime Minister, our government, that please distance yourself. Please, the suffering, let me tell you one thing, the suffering and hardship of these 3 weeks of distance and quarantine, it is 1,000 times lesser than if we don't do that and what is going to happen after 3 weeks. This is my one advice to my countrymen, that please distance yourself. My second advice to my countrymen is that it is a need of hour to act as a single family. It is the need of hour to act as a single nation and support everyone. Those who are prosperous, those who are in a position to support society, I think each family should adopt a weaker section, downtrodden one family. We
Right.
have, each of us have to take a pledge that I will support, my family will support those who are needy and another needful family. If we do this, if one prosperous family supports one needful family, probably we'll tide over this crisis, and we have to show a winning country an example in the rest of the world.
Right, Dr. Bhandari, thank you very much for your time, and thank you for sharing the progress that you're making. And we do wish you all the best, and hope that the treatment path that you've adopted is something that other doctors can do, and future cases can be treated as quickly as you have as well. Thank you so much,
My
and
pleasure. So
thank you so
nice.
much, and good night.
Good night. Good night. ये बेटा रिकॉर्ड
जल्दी से मैं अभी देखता हूँ कहाँ है